So here is one way of thinking about the continuum of COVID-19 innovation spectrum. It goes from living well on the left-hand side through to thinking about early detection of illness, to diagnosis, to treatment, and then finally living with frailty. The living well is about wellness maintenance. It's about all of the things we are doing to keep ourselves both physically and mentally healthy. It includes all of the personal protection kinds of innovation and the problems that we're having to deal with, virus potentially on any surface and in the air. And innovation that we are seeing is around the problems of surfaces being infected and new ways of cleaning surfaces or providing new kinds of surfaces and new kinds of air cleaning and facilities maintenance. Living well also includes the vaccine supply chain, and the vaccine supply chain is very complex, going not only from having to invent a vaccine, but all the way through to having to produce it in small batches and then in very large quantities and then distribute it potentially through the whole cold chain to those who will be administering it and receiving it. The early detection of illness is all of the problems around screening and surveillance. It includes both community and population-wide surveillance and also sentinel surveillance techniques of surveilling and doing contact tracing among small groups. This is a lot of the realm of big data aggregation, and it includes not just surveillance, but understanding the analytics of the health and social system and how to understand demand and capacity. Primary care belongs in early detection of illness, and there's a great deal of work going on, which is very exciting, around wearables that one can breathe into or wear on one's wrist, that's allowing us to detect disease before people become symptomatic and early in the progress of disease. Diagnosis is really around scaling precision testing. And precision testing is happening mainly in centralized laboratories. There are all the problems of getting enough test kits and making sure that we have the reagent supplies and the human resources to do testing and the machinery, to new forms of testing using imaging. And it's now moving into home-based testing, and mobile testing, and all the problems we're trying to deal with spreading testing as widely as we can. Testing is also now moving into the realm of working out not who has the disease, but who has had the disease and is now immune. And that's the realm of serological testing for immune antibodies. Treatment, it goes the range as well, from early stage disease that can be treated at home through to moderate disease, and then severe cases that move into drug therapies and into medtech devices and all of the early stage innovation that we heard around ventilators and the needs of intensive care. And living with frailty then is the realm of the problems related to different kinds of care settings and different kinds of diseases. So all the people who have heart disease or respiratory diseases or diabetes and having to deal with COVID as well, and particularly the people who are impacted by mental health conditions and having to deal with new kinds of social isolation, not being able to get to the kinds of supports that they're used to in the past. And then looking at different kinds of care settings. Obviously long-term care homes is a big deal, and that's also the realm of where virtual care and access to specialty care and the problems associated with booking and scheduling live. So that's one way of thinking about the continuum of care and how we can position innovation and problem solving and the definition of problems in COVID innovation. So in the next few minutes, we're going to choose one of these areas, and we'd like everybody to think about and define one problem in that area.
The problem I'm thinking about is how can we get information out of the electronic record in real time that will help to inform decisions about testing, treatments, who's getting COVID, kind of what's needed in terms of infrastructure, supply and demand. I think we get some data through public health that just tells us numbers of cases and numbers of deaths, but I think it comes at a tremendous lag. I think the technology exists or should exist these days that in fact we could get this in real time that would help some of our decision makers to make better decisions as we go forward. I understand we're not collecting demographic data or to know who's affected, so where we could put resources, where we could put kind of both people and supplies for those people who need it most. That information does exist within electronic health records in terms of the information we're collecting within hospitals, within physicians' offices, but it's just not readily available. I think one of the big barriers has been concerns about privacy. Is there a way to solve that problem? So you're still protecting privacy, but you're getting all that really rich information. I think it's more like a policy issue that has to be solved rather than a technical issue.
We are trying to tackle the issue of virtual care for clinicians. We've heard back from a lot of clinicians that are creating virtual clinics and existing platforms. They're just kind of packing on telehealth options, but they don't really address a lot of the issues that clinicians have, as well as the fact that clinicians don't have business backgrounds. So we're trying to tackle that all in one by making a platform for them and being the source of best practices for them by also creating blogs for them and other content to help them successfully transition from school to producing their own clinics or from physical to virtual.
It was tough for doctors to kind of make the transition from sort of a school to a kind of a running a business, and the concerns about the tack-on nature of many of the products. So kind of the Doxy.me or Zoom or just adding a video sort of lipstick to the pig kind of thing. I kind of only endorse what she's saying, because I've heard lots of practitioners and hospital administrators say exactly the same thing, that kind of we actually need to be become part of the ecosystem. We need to be able to use your virtual care platform to do scheduling, appointment scheduling, to do documentation, and then eventually to kind of do your claim submission, however that happens to be. And the solutions like Doxy.me or the Zoom add-ons have kind of launched us into a place where we're doing lots of virtual visits and video visits, but it's kind of just a beginning part of addressing that solution, and doesn't kind of make a systemic approach.
But particularly with older populations, how do you think you deal with the issue of actually getting the will and the money to do anything in environments that typically have been underfunded?
Well, they're underfunded because traditionally, I believe, a lot of them are manual efforts. So if you can automate those efforts, then potentially so-called underfunded will become just right. We talked to some hospital earlier, and then they said that, oh, contact tracing is so difficult, and the reason is being that they have to call individual to make sure that nobody get exposed to a specific patient. However, you can replace that with something like a virtual assistants or chatbot, so that can relatively easy and lower the cost and everything.
I think to a certain degree it is a generational problem too. Younger generations seem to be adjusting much easier. They are naturally already conditioned for more virtual and automated connections, and they value it as human connections more than, let's say, my generation. I dated myself. So I think it is definitely a generational question. So reflecting back on what I think on mental health concerns, I think the solutions have to be generation specific.
There's always been this assumption that tracking a virus means tracking the people. And it's not exactly clear to me that that is the best way to do that. And I say that I'm an innovation advisor with the federal government in Canada. So it's something I have been thinking about over what makes sense. And In North America, there isn't that much of a comfort level, volunteering, let's say that you're COVID positive, knowing that this might limit the way you live your life. So there's always those two aspects that I was thinking of when I submitted mine, was around what do we really need to track? And if it depends on people volunteering information, what happens if they don't? And I don't have answers to these questions, rather than just things that were in my head as I was putting through what is the challenge that we're going to have here.
As an investor in this space, for example, one of the biggest problems I'm seeing is how do you de-risk something digitally, right? So for example, my fiance is a doctor of physical therapy at Stanford, and she's still doing her job, right? She's not like leaving her job, like she still has to do a job. And so, and they're not requiring, for example, like a distancing, because in order to they're doing telemedicine sometimes, they're doing physicals sometimes, and they're not requiring them to socially distance, because how do you do that when a patient is in your clinic and you have to almost move them, touch them to feel the muscle tissue, all that kind of stuff. So, and what I was telling her was, you almost have to start with healthy and then go to aches and pains and injuries. And similar to this, it's like, I don't know what that maturity model exists in a detection or a tracing model. So if we could talk about some of that, that would be helpful just for me from an investment perspective. But I think a lot of us don't really understand what that maturity is, because we're not involved in the healthcare system enough to even support it from an outside perspective to give the necessary resources.
Called the idea canvas. It is one-page way of synthesizing your ideas so that you can communicate succinctly. Canvases are about communicating an entire idea, the solution, what the benefits are, what the cost structure of solving it, what activities. But today we are only going to focus on 3 specific blocks of the idea canvas. The one on the left, what is the problem that we need to solve? The one on the right, who does that problem impact? And the one in the middle, what is the value to the people impacted by the problem of solving it? What is the value to them? So everybody, this is what we've done today, is we've collected these ideas, and partially the question for us is, where do we go from here? We've spent some time framing problems, but here's some things we can do next in the innovation journey. We can continue working on problems, come back to the repository, you can look at other people's problems. So we can go forward and validate those problems in the next stage of innovation. So feel free to explore our learning programs. And we have a Mastering Innovation Ideation program. It is free for everybody to use if you want to go forward to the next steps of validating problems and then looking for how to build solutioning teams and then plans. We will have another event like this, where we will fill in gaps, invite more people. So please come back and do this with us. We'd also like to collate the list of solutions. So please come back for that as well.